Ask the Doctor with Michael Lange begins in 30 seconds. Ask the Doctor with Michael Lange begins in 10 seconds.
When it comes to your health, are you seeing the check engine light come on more than normal? It's time to get under the hood. It's time for Ask the Doctor with Dr. Michael Lange. Sponsored by Lange Eye Institute and Fortify Vitamins. Dr. Lange is a board-certified optometric physician and certified nutrition specialist, helping people see and feel better through proper nutrition for 25 years. The doctor is in. Call now with your questions at 877-969-8600. That's 877-969-8600. Here's your host, Dr. Michael Lange.
Okay, good morning and welcome to Ask the Doctor. I'm your host as usual, Dr. Michael Lange of the Lange Eye Institute and Fortify Vitamins. I've been hosting Ask the Doctor for 1993. Coast to coast, California, Pennsylvania to Florida and everywhere in between. So this show is catered to you, the listener. No matter how simple or complicated your questions are, we will always try to answer it to the best of our ability. Once again, I'm a board-certified optometric physician. I'm also a certified nutritional specialist. Founded Lange Eye Care and Associates March 15th of 1993. Founded Fortify Vitamins about 20 years ago. And the Fortify Vitamin Company, our sole purpose is to develop the right ingredients, the right science, right for use supplements. We do a lot of investigations. We have a lot of studies. We use it clinically in our centers with our eye care centers to try to help people age gracefully. All right. Remember, God made a pretty good body. As long as the right fuel is given to this body, it can perform at optimal levels. The sad thing is, most of the supplements you buy over the counter, in my personal opinion, are not the right fuel. So check out what we've developed at fortify.com. That's FORTIFEYE. Remember the EYE since I'm an eye doctor. Fortify.com. Also, I'm going to give you the toll-free number twice. Get you save yourself a piece of paper and pencil. A Fortify phone number is 866-503-9746. That's 866-503-9746. And you can call Arlene or Michael or Miss Nita or anybody at Fortify Vitamins. If they don't answer the phone, you can leave a message or you certainly can hang up and just call back. They get really inundated sometimes with a lot of phone calls. Also, you're watching us live on social media all over the world. A lot of you are watching us in, Asia and Europe and South America, Spain. A lot of people from Spain. So hello, Spain. Good morning. It's probably good afternoon or good evening over there. And a lot of people early in the morning in California. So it's like 6 a.m. in California. So we're on Facebook, Instagram, YouTube, Twitter, LinkedIn, all of those social media. So a big shout out. And this morning, Dr. Hall is taken off. So it's Dr. Susan Summerton, who's been a guest on this show many times, and she's helping me co-host the show this morning. And I'm going to say good morning to Dr. Susan Summerton. Susan is an optometric physician, certified nutritional specialist, and I'm going to let you tell everybody a little bit more about your credentials. And she's the asset at the Lange Eye Institute, helping me out seeing patients throughout the day. Good morning, Dr. Susan.
Good morning, Dr. Lange and all our listeners. It's a beautiful, sunny, cool day here in the Villages. I'm looking forward to the show this morning, talking about my passion, nutrition. I have a history that we're both certified nutrition specialists, and then I'm a diplomate of the American College of Nutrition. And it's just a passion to keep reading and teaching. I used to teach nutrition at Hodges University as well.
Yep. And so I've been trying to get Dr. Summerton to join the team for many moons now. It was like 13, 14, 15 years ago. We were at the American College of Nutrition and became certified nutritional specialists together. All right. The phone lines are open. If you got a question, give us a call. It's Ask the Doctors. Consultation is free. never replaces a medical evaluation or an eye evaluation. This is for educational purposes only. 1-877-969-8600. That's 1-877-969-8600. Before we take the first call, I do want to mention that we do have the new Fortify Focus and Brain is now available. The new Fortify Focus and Brain is now available. Hallelujah. It is in the office. You can order it online. You can get it at the Lange Eye Institute, the Lange Nutrition Center, or the Fortify Nutrition Center. So today is Saturday. Come on out. I'll be at the Fortify Nutrition Center for a few hours today from about 12:45 to 2:45. Come on out and pick my brains about nutrition. But the new Fortify Focus and Brain, which we've been talking about for months now, is available. And we're going to expand on that a little more in a minute. But let's go to that first caller of the morning. Everybody knows who that is. Got to get up pretty early in the morning to be Bob. Bob, good morning. Welcome to the program.
Good morning, doctors. Good morning. It is another chilly one. Of course, this is winter, even in Florida. So
that it
we have
is.
to be willing to accept a little bit. I have a real easy question. Well, maybe not an easy answer, but an easy question. Supply chain situations. Do we have any idea when GLA will become available in the stores?
Yes, we do. I have a definitive answer. Black currant seed oil, which is derived, the GLA, gamma-linolic acid, has derived from black currant seed oil, has been on a worldwide back order, all right? And the only place you can get it was out of China, all right? Not to knock the Chinese, but I ain't getting anything out of China that's going to go into my system. So that's just my personal opinion and my ethical approach to nutraceuticals. So, yes, guess what, Bob? It will be in on Monday. It left California this last Monday, and it is on an air-conditioned truck, and it's on the way here. So, unless that guy's, a putt-putt and doesn't have a little bit of race venom in his blood, it should be here Monday. It might be here today. We're thinking it's going to be in Saturday, which is today. But if it's not here, we'll be here Monday. So we've got literally thousands of back orders. People have been waiting for the GLA. Remember, our GLA is sold by itself. It's sold in the advanced dry eye therapy. It's sold in our Omega Relief Extreme. And the reason GLA is so important, it is something that is a deficiency in American bodies, okay? When you think about it, lutein and zeaxanthin in most people may not be deficient because we're eating lots of dark green leafy vegetables and bell peppers and things of this nature. Well, we should be, all right? But nobody's eating black currant seed oil, evening primrose oil, or borage oil, all right? Let's face it. Anybody listening to my voice right now, when's the last time you had a plate of that? Not. Dr. Summerton probably hadn't even had a plate of that. So we're deficient in this nutrient called GLA. And the good thing about GLA, it stimulates one of the prostaglandins, series 1 prostaglandin. So there's series 1, 2, and 3. Series 1, when you stimulate it, it is anti-inflammatory. Series 2, when you block it, is anti-inflammatory. And series 3, when you support it, it is anti-inflammatory. And that's why we developed Fortify Advanced Dry Eye Therapy, because it has all the nutrients that actually stimulate series 1, black currant seed oil, blocks series 2, all right, the omega-3 and the astaxanthin, and also stimulates series 3, the omega-3. So it is going to be available today or Monday, Bob.
Very good, doctors. Looking forward to it. I've been having a few issues, and I think it's because of an absence of GLA.
Well,
hope this solves it.
Very soon, your deficiency would be gone. So, yeah, a lot of people are having withdrawals right now, gamma-linolic acid withdrawals.
Very good. Thank you, doctors. Have a good week. Lord willing, we'll talk to you next week.
All right. And
Thank you, Bob. I've been missing that black currant seed oil for a long time, but we've known I remember a study back in the 80s about black currant seed oil and dry eye, our favorite reason to use it, to give that supportive effect to the people that are already taking their omega-3 fish oils, that what you're talking about, that prostaglandin 1, we know from that study that also stimulates that aqueous tear secretion in the eyes. So it's just a nice supportive effect when we're treating dry eye that we can add to that fish oil and get the beneficial effects of dry eye treatment and also other things like skin and hair. We just love it.
Oh, and also, when you think about it, Dr. Susan, the majority of our patients, the lion's share of our patients are, over 70, over 80, really. And they also have a lot of arthritis, rheumatoid arthritis. So not only do they have dry eye and dry skin, but a lot of them have rheumatoid and osteoarthritis, and some pretty good studies using black currant seed oil and GLA for inflammation in the joints as well. And then, so what better when you combine it with our triglyceride form omega-3, the black currant seed oil, and then the astaxanthin from Fortify Focus. Because remember, astaxanthin is the most potent carotenoid when it comes to oxidative stress and inflammation. So it's kind of a triple whammy of fighting against dry eye and inflammation in the body. What we know now is the root cause of dry eye is inflammation. And I'm holding up everybody in front of everybody right now a box that's called Fortify Advanced Dry Eye Therapy. And what happens is this box, we put Super Omega, a bottle of it in it, a bottle of the black currant seed oil, and the bottle of the Fortify Focus. So it also is great for people that are on the computer vision syndrome. It helps relieve eye strain. It helps filter out the harmful blue light, increase macular pigment density. And it's just a great synergistic type product. Well, all three of these work well together. We could repackage it and call it advanced skin therapy, advanced joint therapy, eye therapy. And now finally it is available again because the black currant seed oil will be in today or Monday. So all of you that are on back order, you will get the shipment very soon. But check it out on the web. Go to Fortify Advanced Dry Eye Therapy at fortify.com, Fortifeye, fortify.com. All right, phone lines are open. Dr. Susan Summerton and myself, Dr. Michael Lange, here to answer your questions regarding your vision, eye care, or a nutritionally related topic. It doesn't have to do, in regards to your vision. Give us a call at 1-877-969-8600. That's 1-877-969-8600. All right, let's go back to the phones. Barbara in Palm Harbor. Good morning, Barbara.
Yes, good morning, Dr. Lange and Dr. Sue. What a great team you kids are. I just love it when Dr. Sue's on with you. I have a very important question concerning glaucoma. I have two very good friends that have really suffered with this. Both of them have had to have pressure removed from their eyes several times. Can you please open and give me some insight and also touch on nutritional things that could possibly help my friends?
Absolutely. So I'll start and then Dr. Summerton will expand. So, glaucoma in a nutshell is when the pressure goes up inside the eye, the intraocular pressure, and it's too much for the optic nerve to handle. And it's different for everybody. Some people can handle elevated pressure. Some people cannot. Okay. So just pressure by itself is not a diagnosis for glaucoma. You can have a 25 pressure and yet not have glaucoma. By the same token, you can have a 15 pressure and have glaucoma. So we look at many different pieces of the puzzle. We look at optic nerve health. We look at nerve fiber layer. That's the insulation surrounding your optic nerve. We look at the functioning ability of the optic nerve via visual field testing. We look at the thickness of your cornea, diurnal fluctuations in the pressure. We have some sophisticated equipment called visual evoked potentials and electroretinograms that are kind of like EKGs of the optic nerve. That these are all utilized by optometrists, optometric physicians, and ophthalmologists to help detect glaucoma in the early stages. Remember, the key for glaucoma is early detection. You have no symptoms until it's too late. And that's why I urge everybody, if you haven't had an eye exam and your children haven't had an eye exam, get them into the local optometrist or ophthalmologist, have a complete dilated eye examination, because only the eye doctor can detect glaucoma. Remember, no symptoms until it's too late. And then you go blind. Glaucoma you can go blind from. So we treat glaucoma medically with topical drops. We treat it orally with medications, and we treat it surgically with very minimally invasive surgery like lasers and certain types of little shunts. And then they can do major surgery also. And the key is to never have major surgery. As far as natural approaches to glaucoma, I always preach to my patients, get down to your ideal body weight. If you're overweight, lose weight, get down to your ideal body weight. Sometimes that's much tougher than it's promoted. So you got to try to lose that weight and get down to your ideal body weight. Cardiovascular exercise is crucial. We found that if you do 20 minutes, 30 minutes of cardiovascular exercise a day, it can actually bring the pressure down in some individuals as much as 30%. Vitamin C at high dosages can help. Omega-3 can help. Saffron can help. There's a product called Myrtaginol that we have at our offices and we have on our website. It's made by Life Extensions, and it's called Eye Pressure Support. It's a combination of pine bark extract and bilberry. And Dr. Summerton and I probably have more patients than anybody in the world probably on these products to help decrease the pressure. Remember, these are adjunct ways of supporting the eye. They don't replace medication. They don't replace drugs. So they can be used in conjunction. I love using the eye pressure support combined with something called latanoprost. It's kind of a double whammy at lowering the pressure. But ideally, Barbara, we get the body in better shape. Remember, the eye follows suit. Dr. Summerton is an expert in this area, of course, in nutritional intervention for the eyes. I'm going to let her tell us a little bit about what she has to say.
Yeah, I agree with everything you said. And that's one of the things with glaucoma is we can't really feel it. And you can actually have 20/20 vision and have glaucoma because it's that peripheral vision that you're losing. And you can lose small amounts without even realizing that it's gone. So we like to check all our patients, at least screen them for glaucoma, and then we can expand upon that more detailed testing if we see something suspicious there. That Myrtaginol that you were talking about, I know she wanted us to talk a little bit on the natural side. It is one of my favorites for that additive effect, integrative approach to glaucoma. And it's not new. People, they're surprised when they hear about it, but I believe the study was back in 2010, and that showed like a 24% reduction in eye pressure from that supplement of that pine bark extract and that bilberry. So anything we can do to help these patients and keep them seeing and keep them healthy, we want to do. And we've got the studies to back it up. I also like to include the green leafy vegetables as well. Your spinach, kale. One of my favorites is arugula. I love adding that into salads. But even and also, I think you mentioned vitamin C.
Yes.
That Sun Project study was the ACE, vitamin X, A, C, and E, and those help protective of glaucoma as well. So we have lots we can do, but it's all individual treatment. A lot depends on each patient and what type of glaucoma they have and how long they've had it and how far along it is.
Yep, absolutely.
Wow.
And so Dr. Summerton can be seen at the Lange Eye Institute in the Villages, Florida. I'm going to give the phone number to the Lange Eye Institute. So write this down. I give it to you twice. It's 352-753-4014. Lange Eye Institute in the Villages, Florida is 352-753-4014. Barbara, that was a great call. That was a great question.
Oh, well, thank you. Those were great answers. Thank you so much for covering that. Have a great day, guys.
All right. Bye-bye. And remember,
Barbara.
glaucoma can affect anybody at any age, And I know Patricia was on hold in Alabama for a few minutes. Patricia, you can give us a call back, and I promise I will get to your call next. So you're listening to Ask the Doctors, 1-877-969-8600, 1-877-969-8600. Before we take the next call, I know Steve's on hold. Steve, just hold on for just another minute here. I wanted to mention, once again, we've been talking about Fortify Focus and Brain for some time now, and it is finally available. It is in the location. It is in Fortify Vitamins. So what I'm trying to say, the phone's ringing in my ears, so it makes me a little confused. So anyway, Fortify Focus and Brain is now available, all right? And you can come into the Lange Nutrition Center in Ocala, Lange Eye Institute in the Villages, or you can order at fortify.com. Remember, Fortify Focus is our Fortify Focus that is got cognizine in it as well. So remember, Fortify Focus and Brain is lutein, zeaxanthin, astaxanthin, and cognizine. Cognizine is a patented form of acetylcholine, which is a neurotropic that supplies brain energy. Okay. Studies support its focus, its attention, memory. It nourishes the brain and increases phosphatidylcholine. So there's some amazing science behind Cognizine. We also have now Fortify Gamer Extreme available. So we have Fortify Gamer Extreme is basically the same product, it's just labeled differently for the gamers out there. They don't want it to say focus and brain. They want it to say Gamer Extreme. So it's two products, basically the same product, just labeled differently. So check it out at fortify.com, Fortifeye, fortify.com. And you can call Fortify Vitamins at 866 503 9746. That's 866 503 9746. So we all started taking Fortify Focus and Brain 2 days ago. And so we'll see how my memory is. And mom, who's 96, I started it yesterday. And we'll see, at 96, she's starting to have a little short-term memory. We're going to see if it helps or not. So she's like a little controlled study. All right, we're going back to the phones. Patricia is back, and then we're going to Steve. Patricia in Alabama, thanks for calling back. Good morning.
Good morning. How are you?
Fabulous. And yourself?
I am great. I will be seeing you probably in about 4 weeks. I need some scans on my eyes.
Okay.
My question, my son has had a bout of diverticulitis. And here lately, he's been on a clear liquid diet.
Mm-hmm.
So I'm kind of wondering, is there something else that he can take that might help reduce the inflammation?
Right. So diverticulitis and diverticulosis is, can be a big problem. You can have a lot of pain in the lower abdominal area. And obviously following his primary care physician's advice, a gastroenterologist's advice, diet is crucial. And if you go, I've got a lot of great information on that. If you email me, I can load you up on more information than you ever wanted. But an anti-inflammatory diet is very good for that. And also, things that have prebiotics and probiotics in it. So taking a good probiotic, taking a good prebiotic, taking enzymes prior to cooked meals is very important. Some doctors will say it's, you should stay away from things with little seeds in it, things like strawberries and stuff like that. I don't know if that's been proven to be that effective, but, you need to definitely follow his physician's advice on this. But, eating some fermented food, taking probiotics, taking enzymes, eating some food that has prebiotics in it as well, an anti-inflammatory diet similar to the Lange survival diet, okay? Because things like FODMAPs and gluten and lectins and phytic acid and protease inhibitors and oxalates, these are all anti-nutrients that potentially have aggravated synergy to the gut. So for all sorts of problems like diverticulitis, IBS, ulcerative colitis, Crohn's disease, a whole host of problems. So nutrition is crucial, proper nutrition. And if they have them on a clear diet right now, I'd follow your doctor's advice for sure. But if you email me, I'll give you my personal email address. It's idude92@icloud.com. So I'll spell it out. EYEDUDE 92. So idude92 at iCloud.com and use the letter I, CLLOUD, iCloud.com. And I've got a lot of great information for you. Susan, what do you think about this?
Absolutely. It's all about the diet. I think mostly eliminating the bad things that can trigger and flare up that inflammation for that particular red meat, those like refined grains, those full fat dairies, and of course fried food to stay away from, and those anti-inflammatory foods like you mentioned in the FODMAP diet to reduce that inflammation, and fermented foods, sauerkraut, kimchi, and even if anyone heard of kombucha, that's one of my favorite drinks to get those good probiotics in you that actually taste really good. Increase those things like Brussels sprouts, onions, garlic, all those nice foods that are going to help soothe it. But while he's on that liquid diet, we've got to be careful and just kind of, I think he's probably giving his digestive system a rest to help heal
Yes.
it.
Yep. And you know,
He's
our organic blue-green superfood, we've got lots of doctors that use this for patients that are on specific liquid diets. You know, our organic blue-green superfood is gluten-free, FODMAP-free, all certified organic. It mixes up in water and it at least gives him, you know, the antioxidants, the mushrooms, the enzymes, and the probiotics. So this is great for digestive disorders. I don't know any doctor that would frown upon it. So that's something to think about. It's Fortify Organic Blue-Green Superfood, and you can always discuss it with his doctor.
Actually, I have just ordered that.
Outstanding. You're ahead of the game.
Yes. And also, I did order the brain, the new one that you came out with. It's going to be interesting to see how it works.
The focus and brain.
Yeah.
Right. It's going to be interesting for a lot of people. Yeah. So we're one of the first that combined all four of these nutrients together. I mean, we investigated this for, you know, over a year, and we finally went ahead and put it together. You know, our Fortify Focus, tens of thousands of people take it globally, and we simply added the cognizine. I was taking cognizine by itself, you know, for, I don't know, months and months before this came out. And, you know, my short-term memory's always been pretty good. I don't know if it's better now or not, but it seems like I have, I don't know, maybe more mental clarity. I don't know how I could have any more, but I'm on the go. It seems like I need even less sleep now. So I don't sleep much. As Susan knows, I don't sleep much. 3 hours and I'm good to go.
I know. I'm listening to you say you get up at 4 o'clock in the morning and go work out. I got up at 4:30 this morning, and
But
I didn't go
did you work out?
but I'm working in the storage room.
All right. Well, Patricia, we look forward to seeing you. So both Dr. Summerton and myself will say hello to you because we were gone when you came in. And I think you had called last week and you had seen Dr. Lori Caputi, who's awesome. So we'll all have to come in and say hello and take a peek at you.
Well, that sounds great.
All right. Thanks for the call, Patricia.
Thank
Thank
you,
you.
and I will.
Bye-bye. All right, you're listening to Ask the Doctors. Dr. Susan Summerton and Dr. Michael Lange of the Lange Eye Institute. Give us a call at 1-877-969-8600. That's 1-877-969-8600. Let's go to Steve. He's been biting the bit. He's been on hold for probably an hour. Steve in Clearwater, good morning.
Yes. How are you today? Bob was talking about the GLA and the borage oil and that. One group of people I thought would benefit from that a lot is the people who take aspirin, because one of the disadvantages of aspirin, and it's pretty much a positive substance, but one of the disadvantages is it blocks prostaglandins, but it also blocks the good ones. Like it blocks the bad ones like thromboxane, which causes clots, but it also blocks the good one, prostaglandin, which prevents clots. And the thing I was thinking is, you know how they tell people on Plavix and stuff, take a baby aspirin? That's because of this. It's enough to block the bad one, but not too much to block the good one. Whereas GLA should protect you from that. So you should be able to take more aspirin without that deleterious effect.
Wow. You know, only Genius Steve would think of this, but you bring up a valid point because it will help stimulate series 1 prostaglandins. So that's very interesting. And you know, there's a lot of controversy about aspirin therapy right now, you know, so.
Well, one thing about prostacyclin, do you know what its half-life is in the body?
Nope.
About 45 seconds. So it's produced and it's destroyed in about 45 seconds. And that's why that's so important to have a diet that can produce it very quickly. But yeah, I think it's generally positive for aspirin, but there's nothing that doesn't have a bad side effect here or there.
Right, and especially everything in moderation. You know, when the doctor tells you to take 1 baby aspirin a day, that doesn't mean take 5 regular aspirin.
Right, and what the thing about it is, even if you do take a lot of aspirin, you still the anti-clotting effect will always predominate. It's just the ratio that changes. So I don't know. That's just an idea.
All right, Steve, thanks. Steve always
Okay.
brings up some questions that make you go, All right. You'll have to meet Steve one day, Dr. Susan.
Look forward to meeting him.
All right, phone lines are open 1-877-969-8600. That's 1-877-969-8600. Remember, if you're just tuning in, the black currant seed oil GLA will be available maybe today, Saturday, if the truck comes in, but hopefully it'll be available Monday. So a lot of you that are on back order, it will be available. But now you can order it online at fortify.com. You can go to Advanced Dry Eye Therapy, and that combines our omega-3, our Fortify Focus, and the black currant seed oil. And we may have it where you can get Fortify Focus and Brain with the advanced dry eye therapy down the road instead of the Fortify Focus. So maybe we'll have that as an additional add-on for a few extra dollars. So remember, Fortify Focus and Brain is available now. So it has all the benefits of Fortify Focus, plus the additional benefits of the cognizine, which helps support focus, attention, memory, nourishes the brain. Some amazing science behind cognizine. So that's why we developed it. Kind of like why we developed the next gen curcumin not too long ago. We came out with that probably, I don't know, close to a year ago now. Curcumin is one of the from the turmeric root, the polysaccharides, the essential oils, turmeric root, instead of just the curcumin, increases the bioavailability. 52 and a half times more bioavailable than C95 curcumin, which is kind of the gold standard. So the interesting about this, we're going to talk briefly about anti-inflammatory, how we talked about series 1, 2, and 3 prostaglandins. But this suppresses something called nuclear factor KB. So that's NFKB. It also decreases cytokines. It works on the prostaglandins, the COX enzymes. So when you combine that with the omega-3, it's the double whammy of fighting inflammation, and that's what we call omega relief. And you can get that. I think it's $50 online at fortify.com. Omega relief combines the omega with curcumin. But we've all curcumin in our clinic. I've got a lot of patients on it now that have chronic uveitis and iritis. And Dr. Summerton and I see these patients all the time. These are patients that have had either trauma to the eye, or they have a collagen vascular disease, an autoimmune disease, arthritis, ankylosing spondylopathy, believe it or not, sexually transmitted disease, or something that causes chronic inflammation in the eye called iritis and uveitis. And a lot of these patients are on, long-term use of steroids. They're on prednisolone acetate, Predforte, Durezol, chronically long-term. Long-term use of steroids can cause cataracts and can cause glaucoma. And we put them on omega-3 and curcumin, and I have an amazing result with that. I see a lot of these patients that have been on low-dose steroid therapy for, 10, 15 years, some of them, get off of this low-dose steroid therapy. And so this is also helping inflammation in the body. So, Dr. Summerton, what do you think about using some of these anti-inflammatory supplements to help these patients with this chronic inflammation?
Absolutely. And curcumin is one of our favorites. In case our listeners don't know, that yellow, curcumin is the yellow pigment of turmeric. That's that spice that we use. Like when you go to Indian restaurants, you eat those curries, that's what's turning that yellow. And we like to concentrate it in a very absorbable nutrient to get what we call a therapeutic effect. And that means it's going to have enough in it where we can see it lower inflammation, or we can see it have the antioxidant benefit. There's so many conditions. They all kind of start with inflammation. I know diabetes, that even we've got studies that show can help have anti-diabetic properties, which is just a nice, simple thing to add to what you're already doing. Macular degeneration, same. We've got a lot of nutrients we give to our patients for that. But if we need a little bit more, we can add that curcumin from it. I know there's studies that protect those retina cells that we base it on looking at what happens inside the eye, get that neuroprotection, protect those retina cells, lower that inflammation. I don't know, people have heard of, we talk about it a lot when we're seeing patients, we're looking for those drusen deposits. And we've got a study that says it reduces the size of those drusen deposits. And we don't want those drusen close to the macula because we know that's going to lead to that macular degeneration. So we're constantly looking for things preventative and then also additive to what patients are already doing, keep them seen and keeping them healthy.
Absolutely. And remember, I always say God made a pretty good body. So it starts with our diet. So getting on a good diet, doctors talk about the Mediterranean diet, the paleo diet, plant, paradox diet, things like this. And I've taken all of that and fused it into one diet called the Lange survival diet. So the Lange survival diet, I really thought it out for a long time before I, posted it online. And you can go Lang survival diet, Google it, and then you can just print the page. It's one page. It's very simple. Tells you what to eat. And basically you eat those foods, and that is the ultimate in an anti-inflammatory diet for your body and your gut. So remember, it starts with our diet. Macular degeneration patients, especially, we take extra time, Dr. Summerton and I, on counseling patients when they come in with macular degeneration, counseling on what to eat, what not to eat, adding dark green leafy vegetables, kale, spinach, collard greens, Swiss chard, arugula, adding things like wild Alaskan salmon, orange bell peppers, goji berries, blueberries, coconut oil instead of olive oil, and, talking about the right foods, but also adding a good supplement. So we've got a supplement called Advanced Retina Formula that is based on the AREDS 2 study. We changed it around quite a bit, however, and it's an inexpensive supplement that has a lot of great science behind it. It's called Advanced Retina Formula for macular degeneration. Look at the information and the science behind it at fortify.com. But the one that I really like best, and I've changed that formula 14 times, is our macular defense formulas. And those are at 30% off right now on the fortify.com. Remember, these are not miracle pills. They're not a treatment for your macular degeneration. They're nutritional support for the retina and the entire body. So check out Fortify Macular Defense. We have one that's called Zinc-Free Macular Defense and regular macular defense. They're 30% off for the rest of the month, okay? So this is mid-January, early January still. So 30% off for the rest of the month. Fortify Macular Defense, Zinc-Free Macular Defense. And you're wondering, which one do I buy? Well, I've got 4 steps that you can read on the website that I've put together personally because I've been doing this for 30 years, and I have probably more people on nutritional supplements than just about any doctor in the country, if not the world, for macular degeneration. So I've learned throughout the years, remember, using blood tests and intracellular blood tests and DNA tests and things of this nature, and seeing clinically how patients react to nutrients. So I ask my patients 4 things. I ask, number 1, are you alcoholic? If you drink too much booze, you need the one with zinc. I ask if you're vegetarian. If you don't eat any animal protein, you need the one with zinc. All right. I ask if you have ulcerative colitis or Crohn's disease. If you do, you need more zinc. And then I ask if you're on a diuretic. And if you're on a diuretic, you need the one with zinc. Otherwise, everybody else needs the zinc-free macular defense. Too much zinc based on your DNA can actually accelerate macular degeneration and possibly neurodegeneration as well. So check it out at fortify.com, the macular defense formula, zinc-free or regular. And we see a lot of patients with macular degeneration, don't we, Dr. Summerton? A lot of patients. And the lion's share of the patients, if they've seen us, are practicing what we preach, don't we?
We do, and we see a positive difference when they spend that money and put that time into changing their diet and adding those supplements, that they really do reap the benefits of it. And it's very rewarding to see when people are doing better and seeing better.
Yep. And so for macular degeneration, we really do have a state-of-the-art facility at the Lange Eye Institute. We have OCT cross-sectional image of the retina. We have RHA, one of the only people in Florida with an RHA unit. This is kind of like an MRI of the retina, fundus photography for the retina, dark adaptation technology. It's kind of like virtual reality. You put a headset on for this. We have high and low contrast testing, electroretinograms. So we have a lot of things that can help us monitor your progression or your digression. And of course, upstairs in the Lange Eye Institute, world-class retina center. Dr. Michael Tolatino has his retina department up there. He's Harvard trained, an amazing retina specialist. So we've got a lot of people that come from all over the country for kind of a more natural, complementary approach to macular degeneration. And yes, in the Lange Eye Institute upstairs, they do a lot of injections, whether it's an Avastin injection, Eylea injection, Lucentis injection, or some later, earlier, new innovative injections. We do that. But my goal is to decrease the chance of my patients ever having to have an injection for the wet form of macular degeneration. And like I said, if you follow our advice, I think statistically, you're at a higher percentage of slowing down this macular degeneration. All right, we're going to open up the phone lines. We got time for many more calls. If you got a question anywhere in the continental U.S., give us a call at 1-877-969-8600. That's 1-877-969-8600. Also, last week or the week before, I had a caller wanted me at the very end of the show, a male, a young gentleman wanted to know about things I recommended, any type of smoothies or anything to boost testosterone. So I'm going to go over this really quick before we take the next call. Dr. Mike's testosterone boosting smoothie. All you guys and gals out there, perk up for this. So you take 1 scoop of our grass-fed fortified whey protein isolate, all right? Whey protein has been shown in many clinical studies to actually help increase testosterone production. Also, whey protein is great for your immune system because of the immunoglobulins and the covalent bonded cysteine and lose fat. Take of pomegranate juice, all right? Pomegranates are a potent source of dietary nitrates. So if Bob's still listening, he loves this. Dietary nitrates convert to nitric oxide, increases circulation everywhere. It's a potent antioxidant. Pomegranate is one of the most potent antioxidants to combat against oxidative stress. There's studies have shown that testosterone goes up 24% from drinking just 1 glass of pomegranate juice for 2 weeks. 24% bump in your testosterone. It also decreases estrogen, which ultimately increases testosterone, the ratio, right? They have a special enzyme. If I could forget what it's called, it's like aromatase or something like that. It's a special enzyme that converts testosterone to estrogen. Well, pomegranate blocks this enzyme, so you don't have all the estrogen. So we got pomegranate juice. We got whey protein, put a little honey in it. Raw honey, local raw honey, very high in boron, which actually increases testosterone. It actually affects the calcium metabolism as well. So it's good for your bones. All right. And it also has something else. It has a chemical called chrysin that actually converts testosterone to estrogen, and it also increases nitric oxide. Also, an egg. Take 1 egg. If you want to cook it a little bit, you can. If you want to put it raw, you can do that too. Believe it or not, egg has cholesterol in it, but it's the good type of cholesterol that is the building blocks for your sex hormones, for testosterone. Eggs are high in choline, which is essential for the release of the nitric oxide. Vitamin E, iodine, selenium, magnesium, omega-3, the B vitamins, D3 and K2, and a little zinc as well. So you use that. You add a half a banana, a little bit of pineapple because of the vitamins, and the bromelain. That's an enzyme that helps promote testosterone. And then just put a couple of pinches of sea salt. That helps lower cortisol, which thus increases testosterone. There you have it. Dr. Mike's testosterone boosting smoothie, fortified pomegranate, raw honey and egg, banana, pineapple, and a little pink Himalayan sea salt. All right, we're going back to the phones. Let's go. Greg in Sarasota. Thanks for holding. Good morning, Greg.
Hey, good morning. How you doing?
Fantastic. And yourself?
Not too bad, not too bad. Where you guys at? Where you located at? Where you based at, your show here?
With Salem Media in Tampa Bay. And you're probably picking us up on 9:30 a.m. in Sarasota.
That's right, that's right. Okay, listen, man, I'm at work. I just caught your program, so I'm just asking a quick question. Fortified.com, if I go on that, I'll be able to get a hold of the right product for the right thing that's going on with me, or what do I do here?
Right. Yeah, go to fortify.com. That's FORTIFEYE. Remember, I'm an eye doctor, so it's kind of playing words, fortify.com. And then look, we have it broken down into, individual, into eye, into brain, into gut. Right. So you can go and then you can see the science. We have all the studies also. And then if you got a question, there's a section, Ask the Doctor on there. It comes right to my email.
Okay, that's what I want to talk about. Okay, that's good. So I'll do that first, and then I'll give you a shout, and maybe we can do some business.
All right, Greg, you take care. Bye-bye.
Thank you.
Hopefully a little warmer down in Sarasota. I mean, that's about, 60 miles south of us. So it gets a little warmer down there. 1-877-969-8600. You're listening to Ask the Doctors. Dr. Susan Summerton of the Lange Institute and Fortify Vitamins. And, of course, myself, your host for 30 years, Dr. Michael P. Lange. P for Paul. All right, 1-877-969-8600. Let's go to, I think it's Mary in Gainesville, Florida, my old stomping grounds. Good morning, Mary.
Good morning. My question has to do with rods. Once the rods die, is there a way to revive them?
Wow. So the rods, and you're thinking maybe in a rod or cone dystrophy like retinitis pigmentosa or something like that. Is that why you're asking?
Yes, that is why I'm asking.
Right. So that's a very good question. I wish I had Dr. Shalais Kaushal. He's an expert, used to be at University of Florida. He has his own private practice in Gainesville, as a matter of fact. Dr. Shalais Kaushal, he's done some interesting things, believe it or not, with a drug called Depakote, okay? A low dosage, that's an anti-seizure drug. And he's actually seen, he used to be with me, one of my retina specialists years ago, and we used to see visual fields actually improve on patients with RP on this drug. But also in the earlier stages, high dosages of vitamin A palmitate, omega-3 fish oil, and the triglyceride molecule, these things can potentially help. But right now, Mary, at this point in time, and remember, this is not my full area of expertise. So, there's not a lot that I'm totally aware of. Dr. Summerton, can you chime in on this?
We were actually discussing that the other day, of wishing we had some great nutrients that we could help with these, because the rods and cones, if listeners don't know, those are the actual photoreceptors. Those are the ones that receive the light in your eye. And without them, it can affect your night vision, it can affect your color vision. And what you're talking about, that RP, that retinitis pigmentosa, is a hereditary disease. And we have these patients that we see deteriorate over time, and we want to put them on a healthy diet, of course. And we know that early on in the stages, if we catch it early, that's where the vitamin A can affect it. But in general, just like everything, we want to keep our bodies as healthy as possible. But with these hereditary diseases, it does become a little tougher to help these patients. But we're definitely looking into it all the time, right, and asking questions and researching and trying to find any new studies that we can find to help our patients.
Now, Mary, the University of Florida actually years back in their retina department, they did some studies where they were able to reverse to a certain extent, animals, I think it was dogs, with genetic therapy with retinitis pigmentosa. So this is an area that there, is constant evolution of research going on, and we try to stay abreast of the latest changes. The microchip implants, the bionic eye device, for patients that have really lost significant vision or gone blind from some of these retinal dystrophies. There's a bionic eye device that actually restores vision. It's the Center for Eye Research in Australia, and it's an implant, believe it or not, on the skull, and attached lead electrodes to the back of the eye. It's a pair of glasses with two cameras on it, and it's called Bionic Vision Technologies. And so it's interesting. And then there's another team at Monash University that's developing the first bionic eye, and it's supposed to pass FDA approval here in the near future. Now, I'm definitely trying to stay abreast of those changes. So once one of these bionic eyes is a viable option, we'll certainly let our listeners know.
Okay, well, that sounds pretty good. I had another question, but you pretty much answered it. It had to do with zinc. And basically what you're saying is, unless you have those 4 conditions that you mentioned, stay away from zinc. But the reason zinc came to my mind is because you hear a lot of suggestions now for people that want to improve their immune system, right, in general, because of the COVID-19 or avoiding it or whatever. Zinc seems to be an important and very significant supplement.
Right.
But
so, Mary, we're about out of time. There's the music. Yeah, but the problem is a lot of people are just taking way too much zinc. If you take too much zinc, it causes a copper deficiency, causes a whole host of problems. If you're eating animal proteins, you're usually getting enough zinc, but that's a whole nother show. We're about out of time. Susan, you got about 10 seconds to tell everybody goodbye.
Goodbye. Have a great, wonderful day, no matter where you are in this country, and God bless.
Thank you. Thanks for tuning in, everybody. God bless you and God bless America. We're out of here. Have a great day. Bye-bye.